Am I audible or not?
Yes, ma'am.
Acha, PSM practical. I will take your PSM practical. Okay. We were discussing about infection in the last class. So, what was the last in the last class about infection? Where did we stop in the last class? Say fast. PSM practical, we were discussing about infection. So in the last class, what was the last thing that we have studied? Yes.
Sources of infection.
Sources of infection. Okay. I will show you one screen. Are you able to see the screen?
Yes, ma'am.
Yes.
Okay, do this. Write this. Infection, then primary infection, reinfection means again getting infected. Okay, then secondary, then focal infection, cross infection, nosocomial. Nosocomial infection will be mainly spread in the hospital setting. Okay, in the hospitals. Then introgenic infection, endogenous. You write first. Do this in your practical copies. Write down. Finish writing? Have you finished or not?
Yes, ma'am.
Finish.
Ma'am, we
Yes,
have to
ma'am.
write this.
Huh?
We have to write
Make
this.
the diagram in this way, exactly how it is given.
Who gives how much NSP give science diploma student?
Ma'am, this is the
Yes.
next topic or we have to continue?
No, it's the same topic for infection. PSM practical. Finish writing?
Ma'am.
So infection, okay, the types. You can say these are the types of infection, or like through how the infection is spread, okay, from one person to another or to the host body. So first is your primary infection. In primary infection, what does it mean? Primary infection is especially when a person, okay, is infected for the first time. Okay, it is known as the primary infection. Means when the patient or the person is infected by pathogens or any kind of bacteria or viruses for the first time. Okay, when he or she is exposed, that is known as the primary infection. Reinfection means when the person again gets infected, okay, for the second time. And secondary infection means what? It specially happens at the time, okay, when the treatment has started, okay, especially in the hospital setting. During and after the treatment, whenever the infection has spread to the person, okay, at the time of you can say at the time of operation, okay, when the person is being operated, maybe because of some external factors, the person got infected, that is known as the secondary infection. Then your focal infection is there. In focal infection, what will happen? It will just cause, okay, the symptoms will be caused in the body itself, okay, and it is specially of the bacteria type, this focal infection. Okay, cross infection is when the infection spreads from one person to the other person, okay, that is known as cross infection. Okay, like for example, now if I give you the present example, then for COVID-19, okay, for coronavirus, what you all are doing for preventing cross infection, used to wear masks, okay, used to wear hand gloves, used to wear sanitizers, used to put on sanitizers. So why are you taking all these precautionary measures? You are taking these precautionary measures so that you can prevent cross infection from the infected person. Okay, so that is known as cross infection. Then nosocomial infection. Nosocomial infection, it will specially occur in the hospital setting. Okay, when people are exposed, when the medical people, okay, or the medical practitioners, the doctors, the nurses, or the healthcare team members, the paramedics, whenever they're exposed to the hospital setting, sometimes because of patients, okay, they get infected, because sometimes because of syringes or because of the hospital materials that are present, because of that they get infected. So that is known as nosocomial infection. It specially occurs in the hospital setting. Okay, then comes your introgenic infection. This is just the causation of a disease. Okay, whenever disease is caused in the body, it is known as introgenic infection. Then endogenous infection. Endogenous infection is what? It occurs from the agent, okay, from the infected agent, from the person who is infected. It will specially arise from that person. Okay. And next is your exogenous. Exogenous will be, exo means what? Exo means bahar. Okay, exo means outside. So it is specially born in the body, but it enters through his or her environment, through the environment. Okay, exogenous means it will occur from the environment area, from the environment. Then next is your latent infection. Okay, latent infection means what? It will reside in the body of the infectious agent. It just resides. Okay, it stays there and it harms the body and it harms the host cell. That is known as the latent infection. So these are just some of the types. Like you can just write down the names, and if I ask you the types of infection or the ways how infections are spread, then you can draw this diagram. Okay, you can make this thing the same way like I have given you. Okay.
Paramedical
Next,
diploma.
okay. Next, wait. Um, are you able to see the screen? Are you able to see the screen?
Yes, ma'am.
Okay, do this. The topic will be not the topic, but you can just write nutrition and infection cycle. Figure, in figure you can write nutrition and infection cycle. If I ask you the nutrition and infection cycle, then you will have to do this. Okay. This is the cycle of nutrition and how infection is spread. Okay, if you have appetite loss, if you have low immunity or less amount of nutrition in your diet. Okay, we have already studied the various kinds of nutritions. Okay, in PSM theory, nutrition and diet, it was a long chapter. Okay, we have discussed many things about nutrition. So you have an idea now, or you have a clear vision of how nutrition is important in our body, the different kinds of nutrients. So if there is a loss, then malabsorption, when there is inability to absorb properly, okay, inability to absorb properly in the body, then altered metabolism, it will lead to, obviously it will lead to malnutrition. Okay, and when it leads to malnutrition, what will happen? It will lower your immunity, the epithelial barrier will get damaged. Okay, then you will have weight loss, then you will grow flat, faltering. Okay, then it will indirectly or directly lead to infection. Okay, so you should always have a healthy diet. When you don't have a healthy diet, you are more prone to infection. That means you all should be healthy. Into you all already know that health is not only about physical health. In health, everything comes in a package. Okay, like health is a state of complete physical, mental and social well-being. Okay, so even if you say only about nutrition, kintu tumar mentally, if you are not healthy again, you are an unhealthy person. So you should be fit and healthy from all the spheres. Finish writing? Have you finished or not?
Yes, ma'am.
Okay, so this is the nutrition and the infection cycle. Okay, appetite loss, nutrient loss, malabsorption, all this will lead to malnutrition. Okay, malnutrition means what? You already know what is malnutrition. Okay, this malnutrition will lead to lowered immunity. The epithelial barrier will damage. What is the epithelial layer? I guess you have got in your anatomy and physiology. What is epithelia? Anybody? Do you know or not? What are the epithelial cells? Jondeep?
Ma'am, outer covering.
Outer covering. It lines the surface of your skin, right? The surface
Yes,
of your body, and these are of different types, like simple epithelium, squamous epithelium, stratified epithelium. Okay, all these are there in your anatomy and physiology. You study well. Then this thing will get damaged because of lower or less immunity in your body. Because of all this malnutrition, your epithelial cells will become damaged, which will ultimately lead to weight loss. Okay, ultimately your weight will get decreased. You will have weight loss. Okay, when you have weight loss, again some of the other factors is your growth faltering. Growth faltering means what? Means you won't be able to gain your weight soon. Okay, means there will be a slow rate of weight gain. Then sometimes because when the baby is unable to, when the parents are, when the mother is unable to feed the baby properly, okay, because of feeding difficulties, at that time also the baby might suffer nutritional or epithelial damage and also lowered immunity. And sometimes what happens when you go to the mental aspect, at that time, sometimes because of family issues, okay, family issues means unhealthy bonding between the parent and child, okay, where if the parents are getting divorced, okay, sometimes because of child abuse. So what happens? This will affect the child mentally. Okay, so because of that also he or she might become sick. Okay, and his immunity might go down. So these are also some of the other factors which will ultimately lead to your infection. Okay, so this is as a whole the whole cycle of nutrition and the infection cycle. Okay, so okay then, thank you. In the evening I'll take your class on first aid theory. Okay, do you have class now?
Ma'am, we have anatomy practical afternoon,
At what time?
1 p.m.
1 p.m.
Yes, ma'am.
And what about 2 p.m.? Do you have at 2 p.m.?
No,
2 p.m. what do you have?
same, ma'am.
Same.
Yes, ma'am.
Okay, then you join the meeting again. I'll take your first aid theory. I won't take for long. I will take for less hours. Okay, because yes. Moreover, from 22nd you are having puja vacations, so I want to complete few of the things. Okay, because your exams will also approach, and I want all of you to give your exams well. Okay, and about that class test also, study well and appear the test. And on that day, I want all of your videos to be on. If your videos are off, directly I will mark you as absent and I will remove you from the participant list if your videos are off. I want on during the exam time, not other days, but only during exam time. I want your videos to be on. Okay. Okay then. Join
Ma'am,
again. Yes.
exam online or offline mode?
Exam online, of course.
Okay, ma'am.
Okay. It is just I just want to take a test, class test. Okay.
Yes, ma'am.
And it will help you for your internal assessment also.
Okay, ma'am.
Because without any activity, I can't just give you marks. Okay, I have to see your performance.
Yes, ma'am.
Okay. Okay then. Thank you. You please join again for our first aid theory. Join after 5 minutes. Okay.
Okay, ma'am.
You can leave the meeting now.